A very good afternoon to all of you and welcome to the Grants Plus webinar series from Dhwani Foundation. I am Lalita Mohan from Dhwani. Dhwani Foundation is a Bangalore-based non-profit committed to strengthening the social sector by enabling grassroots NGOs to become credible, resilient, and sustainable. Our flagship product, Nirantara, is a comprehensive capacity building initiative that has supported over 490 grassroots NGOs across 7 states. Covering 175 parameters across 8 core domains, Nirantara offers hands-on training, implementation support, technology solutions, continuous assessments, and a final certification. Its immersive approach drives deep organizational change, helping NGOs build strong systems for long-term impact and sustainability. We also work with multiple stakeholders, including donors and federations, to strengthen the broader sector ecosystem. Our vision is a vibrant and credible social sector. Lasting development outcomes require collaborative effort. When donors bring the resources, NGOs bring the grassroots expertise, and governments bring the scale, impact becomes powerful. So that brings us to today's webinar theme, building effective donor, government, NGO collaboration. We will explore what it takes to make such partnerships work, what the challenges are, where the opportunities lie, and how we can move from parallel efforts to shared impact. To unpack these questions and share insights from their own journeys in building effective partnerships, we are joined by a very distinguished panel today, each of them bringing deep experience and unique perspective to this discussion. So let me start by introducing our panelists. We have with us Shaina Ganapathy from the Embassy Group. Shaina leads the outreach initiatives at the Embassy Group. Passionate about education, Shaina believes that transforming the education and health infrastructure in a country will contribute immensely towards the development of a nation. The group's outreach initiatives are therefore designed to provide every child with a holistic education experience and access to a range of resources, comprehensive health programs, remedial interventions, skill development, college education, career counseling, and gaining employment. Actively advocating for collective action through Embassy's unique Corporate Connect program, she draws together leaders and corporates across with a common vision to spur collaboration for deeper and accelerated community transformation. Shaina has been one of the founding members of Stonehill International School, one of India's most respected IB World Schools. She has been an integral part of its strategic growth and serves as a chair of the Governing Council. Welcome, Shaina.
Thank you all. Good evening.
Lalita, you're on mute.
We also have with us Mr. S.M. Vijayanand. Mr. Vijayanand is an officer of the 1981 batch of IAS belonging to the Kerala cadre. Almost his entire career was in rural development, local governance, and decentralized planning. He coordinated Kerala's people's planning for 15 years from the day it started in 1996. During this period, he nurtured Kudumbashri, a highly successful SHG program in the country. He was the chairman of the executive committee of Kerala Institute of Local Administration for 12 years. He has worked as deputy secretary and later as additional secretary of the Ministry of Rural Development. As secretary of the Ministry of Panchayat Raj, he was instrumental in introducing the Gram Panchayat Development Plan, GPDP, in the country. He retired as Chief Secretary of Kerala in 2017. Post-retirement, he is actively involved with many NGOs. He is the chairman of Pradan, School of Democracy and Laurie Baker Center, and president of CRISP, and trustee of Pallium Indies and Banyan. Welcome to the webinar, sir.
Thank you. Thank you very much.
We also have with us Archna Vyas from Gates Foundation. Archna is the Director, Program Advocacy and Communications, Growth, Opportunity, and Empowerment at Gates Foundation. Archna oversees advocacy and communication efforts for two foundation divisions, global growth and opportunity and gender equality. Her work advances the goals of the foundation and its partners in areas such as financial inclusion, agricultural productivity, urban sanitation, nutrition, global education, women's economic empowerment, and women in leadership. Archana joined the foundation in 2014 and went on to hold multiple leadership positions in India office, collaborating with governments, non-profits, community groups, academia, and the private sector. She was instrumental in the creation of the Behavioral Rights Unit within the Indian government's Niti Aayog policy think tank in collaboration with Ashoka University's Center for Social and Behavioral Change. She also spent many years in the advertising industry, where she held leadership positions and supported the launch and growth of many consumer goods brands in India. Archana serves on the World Health Organization's Technical Advisory Group on Behavioral Rights and Sciences for Health, as well as on the governing body of the South Asia Learning Collaborative, an initiative based at Georgetown University's Institute for Reproductive Health that focuses on influencing social norms. Welcome to the webinar, Archana.
Thank you so much, and thanks for having me.
And to moderate the discussions with our three eminent panelists, we have with us Vijay Kulkarni from Dhwani Foundation. Vijay Kulkarni has multi-sectoral experience. He has over 4 decades of experience in the development sector and has worked in areas of banking, entrepreneurship development, microfinance, NGO incubation, livelihood, education, consulting, and research. He co-founded a development resource center which incubated many NGOs. In most of the institutions, Vijay initiated new projects, operationalizing the ideas and building systems. He is on the board of many NGOs. Vijay currently leads the Federation's enablement program of Dhwani Foundation. So welcome, Vijay. So before I hand over to Vijay, a quick note for all the attendees. Please type in any questions if you have for the panelists. Please do type in the questions in the chat box as the discussions are progressing. And we request you to keep the questions relevant to the topics that are being discussed today. And towards the end, depending on the time, how much time is available, the panelists will be happy to take a few questions. So with that, over to you, Vijay, to take the conversation forward with our panelists.
Thank you, Lalita. So it's a great privilege to have such a panel today with us. And also I welcome all our attendees, from across India who have joined this webinar and, are very eager to learn about this collaboration, these partnerships that we are going to talk about. So this topic is also very unique because we are talking about, the tri-sectoral collaborations, government, donors, and NGOs. Usually we are aware about government NGOs, partnerships, and then donor NGO partnerships. But here we are talking about all the three people coming together. And we have these, popular words these days, Sarkar, Samaj, and Bazaar, so which are popularly used to indicate that all the three are very important parts of Indian democracy. So we begin our questions, and in the first question, I would like to ask all our panelists, what are the current programs you are involved in? What are the current collaborative programs you are involved in, where all the three players are there? So you can share 1 or 2 examples and how they are working on the ground and your experiences in that. So I first request Archana to begin and share the collaborative efforts that Gates Foundation is doing in this field.
Thank you so much, and thanks for having me. I think, so first of all, I would say that partnerships and we say expertise is pretty much fundamental to all the work that Gates Foundation does. We realize, and that's true, that if there is sustainable impact that needs to be created, it cannot be created by one entity. You need what you said was Sarkar, Samaj, as well as, people like us who would be donors in the entire process. We realize that everyone brings in their own strength. There is no way that we can match the impact and scale that governments bring in. There is no way that we can get insights and deep-rooted knowledge of communities that the NGOs bring in. And then there is some expertise that the donors do bring in beyond dollars. It's also technical expertise. We usually think that, we see ourselves as a global global convener of knowledge, and therefore, the technical expertise for scaled programs is what any philanthropic organization would bring in. We tend to have, because you donate, you tend to have, a bias for data and evidence. So therefore, we also bring in expertise with data and evidence to be able to measure programs, which is critically important to know whether whatever's being implemented is headed in the right direction or not. So that, programs can then, you can make adjustments, you can make changes so that they become more impactful. I think across the programs that the foundation implements in India, so first of all, we have about 60 to 70% of our funding actually goes towards health, and about 40% goes to our non-health programs. Lalita spoke about my portfolio, which includes agriculture, financial inclusion, as well as, education. So the non-health part of the program, I think across the work that the Gates Foundation does in India, community engagement is extremely important. I am reflecting a little bit in terms of, since you asked for an example, reflecting a little bit in terms of, one of the first programs that we implemented in India when the foundation started our work, which was back in 2003. It was Avahan program, as we fondly called it. It was HIV/AIDS prevention program. And that program actually was North Star when it came to community engagement and community-led program, because at that point in time, we were working in about 6 states that had high prevalence of HIV/AIDS, working with very difficult sex community, and that were our main target audiences. And we would not know reality of their lives, right? What are the challenges they go through? What are the solutions that will work for them? So there were hours and hours spent by our team to understand what that program could look like. And till date, so we actually transitioned that program in 2013 to NACO. Our efforts were largely complementing the efforts of the government. The community engagement, I would say, was focused on creating not only awareness for HIV/AIDS, but it was also preventive tools to be educated to that community, but also safe sex and health. The health was paramount. And till date, I would say that program tends to be a community-led program, which is extremely heartening for us. But it was a big learning for Gates Foundation, because that was our first program. It was big learning for us in terms of how important it is to work with NGOs and how important it is to work with communities for the programs to be successful. We tend to be an organization that also thinks a lot about innovations, but at the same time, for those innovations to be adopted and to be scaled, I think working with non-government organizations, apart from just private sector, is extremely important for adoption as well as uptake of those programs. So from there on, we worked across scale programs, whether it's immunization, whether it's family planning, and tuberculosis, diseases, etc. But one of the critical factors of I would say the improvement in health indicators that we've seen working across, working alongside governments is engaging with communities and to ensure uptake of programs as well. Thanks.
Thanks, Archna. So, Vijayanand sir, you are involved, although you are now retired, but you are heavily involved with NGOs now, and very large NGOs. And those NGOs are involved in a lot of collaborative work. So can you share a few examples that you are currently involved?
Yes. About 2 examples I'll share. First, I'm president of CRISP. It'll be very difficult to describe that organization. We have about 12 mentors, most of them retired Government of India secretaries as chief secretaries, and we work free of cost. So there we are slightly different, but we engage young professionals who are paid, for which donors have been very helpful to us, including Gates Foundation. So our work essentially is, there are certain we don't create policy. If somebody wants to develop policy, we develop and give, but much more than that, policy which is recognized but not operationalized. So we work with the state government, and state government asks us, going through our CV. We can't do everything under the sun. We have strong strengths in Panchayat Raj, SHG, tribal development, higher education, health, and so on. The states request us, and we enter into an MOU, and typically we work, we do a recce, which we do directly, then talk to the state, find out their needs, then do a kind of a real field work in 3-4 sample panchayats or places, and then roll out a policy. The typical thing is SHG panchayat relationship, partnership is something being pushed for by both the Ministry of Rural Development and Ministry of Panchayat Raj. It's a huge kind of thing which can transform India's democratic landscape once. It will take years for it to mature. So what we have done in Tamil Nadu is that we have come out with a policy government order. Of course, government order has to be issued by them only. We developed it considerably after a lot of discussions, and it's up to the Deputy CM now. In most probability, it will be that. Then we undertake to roll it out in 37 districts to create schools of practice in partnership with government. Then we hope from 37 hub and spoke, maybe in 10 years, it can reach the whole of Tamil Nadu. So that's one positive kind of thing. So far, it's been successful. It's slightly less than 3 years. But then when we go for funding, the donors don't understand this kind of organization. They say you're a think tank, you're a policy NGO. So it's very difficult to describe ourselves. But so far, so good. Thanks to Ashish Dhawan and then, of course, the Gates Foundation. We are doing it and we have a lot of hopes. Now we are in Odisha doing some very, very difficult thing like FRA, PESA. PESA is high-end policy, which after 30 years has not been realized even to 1%. So even if you realize 2%, this is going to be a major achievement. Then, of course, the Pradan part. I'm chair of Pradan. I've been associated with Pradan for a long time from this side of government and later as part of the director board. And Pradan has transformed itself, which is an object lesson. Of course, its professionalism, its systems and performance measurement and all that is very, very, as chairman, I shouldn't be speaking of that, but still it's extraordinary. All the donors and other fellow NGOs know. But Pradan started with supporting the civil society, giving professional assistance. Then it went to direct doing. Then it started what's called leveraging, where you work with government, provide the much needed grassroots field assistance, highly professional assistance. It's not just the ordinary assistance. And now, for example, we spent about 290 odd crores last year, and we leveraged 2,900 crores of government assistance. So the impact is 10 times your investment, which, of course, the donor funding, you'll say you can't have more than 20% for staff. So those kind of things are very restrictive, where you are providing professional assistance. That is where India needs a lot of things. We do that. Now, last few years, we got into networks, particularly post-COVID, of NGOs. Now the idea is for a consortium. Consortium and network, the difference is you do multiple tasks together, sharing, you do health, you do this and all that. So it fortunately works by choice, it works in the most difficult geographies, particularly the tribal this thing, and where public systems need a lot of support at the cutting edge level. And the other important point, we work at a lot of levels. We have PMU, nearly 40 odd PMUs, including 3-4 major, MOUs, including 3-4 major MOUs with government ministries, Ministry of Panchayat Raj, 5,000 blocks localizing sustainable development goals, with NRLM right from 2013 for livelihood activities, down to the state level. And an interesting thing is, I think at least 2-3 states have created PMUs, which are essentially sitting inside the government, which are kind of peopled by experts from Pradan. And funding, about 10-15 years ago, it was 75% foreign and 25% Indian. Now it's 35 foreign and 65 Indian. And now we are getting into new areas like natural farming. It has touched 1 lakh acres. Next to the Andhra thing is the highest thing, with a lot of scope and a new experiment for quite some time, the FPO. So very strong specialization. And we work with the collectors. So it's all levels of government. That's
Thank you, sir, for sharing, the multiple institutional experience that currently you are engaged with. So, Shaina, can you share your experience? Embassy is doing a great job building collaborations across, at least in Karnataka, we know you are doing a great job. So, can you share your experience how Embassy Group is working towards
Sure,
this?
thank you. Thank you for the opportunity. A very good evening to Archna and Mr. Vijayanand and Vijay and team, Lalita. At Embassy Group, we started giving back in a structured, organized way back in 2010. As a developer, our strengths lie in construction, and our first intervention in the early years used to be to bridge the infrastructure gaps in government schools. We didn't want to create a parallel system. We were not educationalists, but we knew how to build. So we decided to select large government schools that are in need of, either new infrastructure or some level of upgrades. We believe truly that if the infrastructure and the toilet facilities are in place, then students will actually start coming to school, especially the girl child. And over the years, what it has taught us and what we've seen is that, it goes a long way in also increasing learning outcomes. So we not only have constructed over 27 schools till date, we continue to build schools, but we also see an increased enrollment of close to 40% across our schools. This relationship with the Department of Education also opened doors to us, helped us strategize where else we should be, focusing our energies on. And foundation literacy and numeracy has been a very important pillar for us. We find that students till grade 10 in government schools tend to be moved up the grades without really, a clear understanding of basic foundational literacy. So a lot of our work, in fact, today, a lot of what we do, over 60% of what we do, is in the space of building capacity for teachers and children, bridging the gap and making them at least, classroom, bring them up to their grade level efficiencies. The other area that we work with is also connected to children, and that's in preventive healthcare. So with the support of some of our corporate partners who are our tenants in our IT parks that we construct, we've been working closely again with the same cohort of government schools. We work with over 126 schools across India, where we create a platform for children to take responsibility for their health. And this means a lot of preventive measures as well. It spans to wash campaigns, drinking water, a lot of volunteer-led preventive workshops for children. And at the heart of everything that we do, we have been successful in collaborating. So collaboration, not just with the government, but also with corporate partners who are like-minded with common agendas. So this is what we do, if I put it in a short way, and it's been a very rewarding journey, a lot of work yet to be done in these areas. So we as a leadership and as a management, we've decided that we won't digress into too many areas. We'll focus on education, and we'll try and see how best we can do to bridge that gap. Environment and disability and inclusion are two areas that we have invested in over the last 6 years as well. We have created a Gram Panchayat model in North Bangalore, consisting of 10 villages, where the PDO, the Zilla Parishad and Gram Panchayat work in collaboration with 2 NGOs on the ground and 4 corporate partners to create a very sustainable model for soil, water and waste. So we've been chipping away at this model for some time, and surely over the last 3 years, we've had a consistent outcome of over 95% plus segregation, 3 water bodies rejuvenated, every single household in the 10 villages committed, paying a user fee, which is not common, and sort of, building an ecosystem that today is an example of how a corporate can partner with an NGO and a government and make this work. Waste being one of the largest issues that I see across, at least, in the areas where we are present around the country. Disability and inclusion has become another, area of focus for us. We currently support 5 NGO partners, and all of them are skilling disabled youth or children. So there is education, there is skill development, rehabilitation, and medical support. So this is the core theme. But skill development and employability is actually at the heart of all of what these NGOs do. So thank you for the opportunity, and I look forward to sharing some more insights later in the session.
Thanks, Shaina. So Vijayanand sir, you spoke about Pradan model where donors are now encouraging NGOs to work with the government. So how do you involve both civil society and also community participation? So this entire new model, that instead of working individually with this, either NGOs or donors working individually with NGOs, donors are emphasizing that you work with the government and we support. So participation of government and civil society both are considered as very important component of this, tri-sectoral approach. So what has been your experience, and where do you see success in these endeavors?
Yeah. Something which we need to recognize is, unlike many countries, particularly neighboring countries, government doesn't deal directly with donors most of the time, except some high-profile donors may meet the Prime Minister or this thing. But the dialogue with donor for policy, but knowledge is used, know-how is used. So that is very weak in India. And with dialogue with NGOs also, is slightly weak or become weaker at the national level, but not absent. It's not zero. It's become decentralized, not decentralized, diffused. So tribal development deals a lot with NGOs. Disability affairs deals with a lot of NGOs. Rural development, not to that extent. So we can map the engagement with NGOs across ministries. And the government of India doesn't seek funds, because I think officially, those not declared, say that India is self-sufficient, we allow you to work at the field. But seeking funds, probably in the 90s, I was Deputy Secretary, Ministry of Rural Development. We used to seek funds. And in water supply, and at that time, initially in the AIDS, NGOs played a big role, even in funds. So that change we need to note. And post-Kapat, government doesn't fund NGOs. So last 10, 15 years, BRLA was created, but it went in a different direction. But at the state levels, it's not a state government as such, there's enough freedom for you to talk to a donor and say, will you come to our state? Will you work? I know Karnataka government is doing it even now. In Kerala, years back, I talked to Ford Foundation. So state level, there is greater freedom to go to donors. And now some collectors are even asking some donors, can you come and work? Which is not more of an NGO bringing some funds. So that change in India needs to be noted. Then at the same time, for certain priority programs, a semi-formal, I will call it a nudge only, like Nidhi Aayog asking donors, not directly, probably not in writing, go to the districts, and it's an aspirational district. And they are asking an NGO, can you do it? It's informal, but it is working. And NGOs, I feel, have certain roles in sectors where government, emerging sectors, which are policy priorities, government may not admit that their capacity is weak, but they need success there. So some of the things are, quickly, if I say, one big thing would be SNGs, and SNGs going to enterprises beyond your poultry and livestock economy. Then skills and jobs in the semi-formal and formal sector. That's an area where there'll be a lot of push, a lot of government priority. And in the difficult areas, NGOs have a big role in these kind of things. Then the governance and development potential of panchayats. Constitutional, I don't know, many of you may not know, I think panchayats will be spending about 2 lakh crore this year from NREGA and the 15th Finance Commission. And I think this will continue, may not increase exponentially. So a lot of lessons are there. Then specifically agroecology, meaning natural farming, Then local action for climate change, that's going to expand below, which only NGOs can do using all the statutes and other funds. Then community-based health, which we saw during the COVID, naturally emerged from below, but I think that will continue for a long time because of the cutting edge levels are weak. Early childhood education, which is being pushed as part of policy, linked to nutrition. Then something which is mentioned by Shaina, this care and compassion, disability, elderly, palliative care. That's another area where for a long, long time, only NGOs can do with donor funding or with government funding. Then coming to appropriate technology, which we started in the beginning when we had started with PAD India way back in the 70s. But now it's coming back, appropriate technology for natural resource management, for solid waste, for even building construction. Then, of course, a big area, it's a bit sensitive area, social accountability. The social audits and all kinds of things they do. Then government would be, then of course, what do you expect the NGOs to do? See, once upon a time, I'm not part of that. I came just after that generation. Government was outstanding in what was then called extension. Now we call it IEC, where you can easily transfer a message to an illiterate person, which is a complex development message. And that was the success of Green Revolution in late 60s, 70s. Now government seems to have lost that capacity. So that the NGO can fill the last mile connectivity, but high-end thing, not just the clerk or the peon or the some part-time worker going. Then, of course, creating field schools or beacons. So that NRLM, I was in Delhi when the start rolled out. The idea was spend all your effort in one block, the others can learn, the hub and spoke model. Then, of course, an idea which has not been given up, it's a very fascinating idea, but working in what's called cluster facilitation. You get NGOs to provide high quality technical expertise to the Gram Panchayat, to the SLGs. We called it CFT and even funded it partially. Then, of course, the model which I mentioned, the PMU, to run a project. For example, NGOs keep the PMU in Ministry of Agriculture for natural farming. Then, of course, capacity building, this new scheme, highly political priority, Daj Goa for the tribal areas, covering all the tribal areas of India, is mostly capacity building. And capacity building is being done by NGOs. So that's a very, very rare thing. Then, of course, the social accountability part, but yet I must be very open about it. New challenges are there, which are unsettling, but nothing unsurmountable. And possibly, I feel NGOs will be more, let us say, more competent after addressing those challenges.
Thank you, sir. So you gave the whole spectrum of opportunities, to work with in this collaboration. So Archana, beyond Afghan, of course, Afghan is a very successful program, and in fact, Gates Foundation deserves credit for reducing the entire HIV, not only in India but across the world. So beyond that, what are the other collaborative efforts where you have pitched with government and also civil society for these collaborative efforts? Do you have any other examples?
Yeah, sure. Sure, Vijay. First of all, Vijayanand ji has spoken about so many of these models. We work closely with him on TIF, on Pradan, as well as CRISP. So he's wealth of knowledge. So and that's exactly what we look for in institutions, experts, authoritative, so to say, we collaborate with all because they bring in the expertise, and that's where I think the NGOs as well, with their, as I mentioned before, their deep insights in terms of community knowledge is where we work a lot with the NGO sector. So Vijayanand ji mentioned COVID, huge experience, right? At that point in time, everybody was constrained within their own homes. How do you reach out to communities? How do you reach out in terms of giving them right kind of messages with, whether it's wearing masks, whether it's about when to go and seek out medical care, and what are the symptoms, etc. So that was like an extremely good example of collaborative effort where everybody came together. I think there are a few factors in terms of what marks success for any program. And those are, having shared vision, having clear roles and responsibility and accountability. Everybody is doing their own role, but there's also feedback that comes back. You asked me about examples too. One I would take, Vijayanand spoke about tribal community. So there is a program that's being funded by Piramal Foundation and by us together with the Ministry of Tribal Affairs as well as Ministry of Health. It's on Tribal Health Initiative. Some numbers that I would point out to, so there is a program which was focused on tuberculosis, because the entire health program is how do you improve health indicators within tribal community. Again, very hard to reach, very hard to communicate to. Very hard, very different contextual circumstances, right? So how do you engage with tribal community and improve their health? So this tribal health initiative is focused towards that. Ashvasan, the program that was focused on tuberculosis, it was phenomenal because it started in 2021, 2022. At that point in time, we were given mandate around, and also because Prime Minister elevated TB as a priority as well. There were elimination goals. So 177 district prioritized, about 68,000 villages, very clearly about 2,000 community workers actually stood up as volunteers. We saw this even with Swachh Bharat program, right? Swachhata Grahis, the volunteers that actually took the program down to the last mile. And these 2,000 more than 2,000 community volunteers actually worked to mobilize about more than 200,000 youth as well as tribal community members. The impact is cascading, right? It's about 10 million door-to-door, 10 million outreach, door-to-door knocking, 10,000, TB patient detected early. So obviously this is life saved, as well as, the program then being cascaded to the other districts as well. So I think it calls for a lot of commitment from these more than 50 NGOs that came forward, and they came forward as far, and they were institutionalized into this program. So it marks quite a bit of commitment from those 50 NGOs, and therefore the community that took forward the program. There could be many other examples. We were, with lymphatic filariasis or hathi pav, debilitating disease. It's very hard. It can be really, really causes huge stigma in community. But again, working with community, not only creating awareness, but LF patients or Hathi Pav patients have come forward to become champions so that they can create awareness. And this is all done through NGOs. This is not like, okay, a donor sitting here or a government sitting. It's not government's work. Like, they can make good policies, but these policies and programs have to be implemented as well. So very effective patient network program that we are doing in some states, which is actually creating a lot of impact in terms of awareness, reducing stigma, but also proactive seeking out of medical care, but also for the mass drug administration, which is super important. 3 drugs to be given. There has to be trust building within the community. It can only come from champions within the community. So I think two programs. One is TB elimination program, and the other one that I would say is for our neglected tropical disease, which is LF or Hathi Pav program that is truly community-led, and we are seeing some great results there. Thanks.
Thanks, Archna. So, you mentioned, especially in the field of health, what the Gates Foundation has done is very, very unique and very, very important. And of course, during COVID, all of us came together. But beyond COVID, during peacetime, how do we come together and work with each other? So, Shaina, you are involved in this corporate connect. So, you bring donors together, and then NGOs and community together at the grassroots level. So a very unique experiment. One side bring the donors together and the other side bring the community people together. So what has been the success story that you have come across?
So I think we started our corporate connect initiatives with a view that let's make giving back a little more sustainable. So in the ecosystems where we worked, we found a lot of overlap. Government was doing stuff, corporates were also doing stuff, NGOs were also there. So we decided to take certain geographies that we had identified. We did a need analysis and we went to the government and asked them, like, what are your priorities in these regions? And in some cases, they were very clear. For example, they needed teachers. There was a shortage of teachers. In some areas, they required infrastructure. And in one particular area, the government told us that we are unable to screen children for basic communicable diseases. Anemia being one of their key drivers, but also things like oral hygiene, vision, etc. So we created a program with large partners who could deliver this, NGO partners, and then circled back to our corporate tenants through closed door meetings with very select. When I say select, it would be a handful, maybe 8 or 9 of us. We did a lot of due diligence to make sure that there was alignment in our vision and giving back. So, CSR has mandates, etc., at the board level. Once we found the alignment in mandates, we started the conversations, but we had a representative of the government in the room guiding us through what their priorities are. And that's been our approach to most of our collaborative models. In the last 8 years or so, we've had multiple corporate partnerships. We're over 118 corporate partnerships till date. And of course, a couple of them really stand out. And then one of them is in sustainable, infrastructure, right? So there is an ecosystem that we've created where there is an NGO partner on the ground, but embassy takes the lead to be advisor, monitor for all our corporate partners. We actually play the role of a manager, so to speak, because of the expertise we have in construction, to ensure that that there are efficiency in costing and of course construction as well. So this is a no-brainer for us because it is what we do as a business, and this has also added a lot of value to our corporate tenants when we build together. The other example that I can go back to, as Archna and Mr. Vijayanand said, was during COVID, we were tasked by the Department of Health in Karnataka to build ICUs. We had 20 ICUs to be constructed in a very short span of time. So CII played the moderator and the anchor for all of us. So we had biomedical, engineers under the Columbia Asia founder Nandakumar Jairam, and of course Dr. Devi Shetty. We had Azim Premji Foundation stepping in saying we'll manage the operations, and we had embassy stepping in saying we'll handle the infrastructure. And with us came another 18 corporates who were very happy to make us the leader to find the need, order and fix the infrastructure piece. So collaboratively, we were able to work with the Azim Premji Foundation team that actually operationalized the ICUs once we set it up. And of course, we had a senior deputy director from health supporting us. I think the key driver, even in the education example I gave, is the ability of the government, for example, at the commissioner level, to appoint a key senior member in their team who reports directly to the commissioner, for example, to deal with corporate funding. All of us, as you know, CSR funding has so many, reporting requirements today, and it needs to be very clear, transparent, and on paper. And I'm sure it's for all the NGOs as well, given the current restrictions. So therefore, with government funding, if you want to collaborate with government or support the government in any way, I think it's important to make the whole process easier. So that's another role that we play. We actually facilitate a lot of donations reaching the government projects through NGOs, of course, but getting them permissions, getting them direction, leadership. I mean, the leadership is so strong, but not very accessible to corporates. So Therefore, that's another role that we felt is a really important cog in the wheel. We also talked to, another collaborative win for us has been to bring in sustainability in our office spaces. So as you know, today we are one of the largest providers of A-grade office spaces in the country. Now, this means that all the GCCs are sitting in our business parks, doing their research and development. So we have a common pledge and a platform to create zero waste offices. And most of us have ESG goals as well. So this has nothing to do with CSR or giving back, but it has a lot to do with creating a culture within our organizations, but collectively having a mandate to drive this forward towards sustainability. This leads to employee volunteering. We engage over 2,000 volunteers every year in various projects. This also allows every individual to take control of the narrative instead of just complaining about waste and water and all of that. And of course, it leads to them wanting to be more involved in the 10-kilometer radius of places where we set up these tech parks. So we typically look at education, water, sewage, and of course, the waste management. So that's been our approach, and it's really been it's not been an easy, fast process, but we go really in depth and we work, on long projects, 3 to 5 year projects. We spend a lot of time advising our corporate tenants and their CSR teams to be a little more sustainable in their approach when they pick projects. Don't jump from project A to B, look at it a little more strategically and long term. And also think about building capacity for the NGO. It's not just about, negotiating on admin fee, for example. I mean, it on the ground, if you build their capacity, it just goes a really long way in making our projects very efficient. Some of the best minds within the NGO really focus on the project instead of trying to stay afloat looking for funding. So these thought leadership platforms that we do it in a very scientific way. We have the right people in the room advising them. Partners like Dhwani have really helped us to strengthen the narrative, and we'll continue to do so. That's part of my personal mandate as well, to help nurture this ecosystem and make the entire collaboration as a sort of a, it should not be difficult. It should be an easily done process. So while Archna was talking about creating, and Sir was talking about creating, strengthening processes, policies, and at that level, I think at the grassroots level, the NGOs need a lot of help to sustain and, and survive in some cases. Yeah. Hope that helps.
So, Shaina, also, it is not a very smooth journey. This collaboration is definitely not a smooth journey. So, can you quote some examples of challenges and how did you overcome them?
I'm sorry?
How did you overcome the challenges?
Challenges. Okay. So transparency is a big one, right? All of us need reporting, measures, impact, all of that. So one thing that's helped me in great stead is getting the partner who is who's joining us along the table to take some responsibility as well. So when we build robust systems together, it becomes obviously transparent, first of all, and then there is ownership, and the whole collaborative model is that much more robust. So that's the way of beating, instead of us taking all the responsibility in a collaborative model, we try and learn from our donor partners, so that it becomes a shared responsibility and not an individual corporate taking responsibility for everybody else. The other piece is actually getting them to join us when we actually do the project and go and see the work. So employee engagement is a mandatory part of our collaborative process, where we get employees to come in and build solutions for us. So for example, I can take the name of Cognizant. We've been partners for a long time. And for us, education interventions in classrooms is an area that we commonly work together on. And we have senior leadership actually involved in designing solutions for the problem. So it goes a long way in keeping us invested in the program. When it comes to Oracle, for example, Oracle is very keen to support the same beneficiaries we look at, the government school children, with enhanced learning environments and healthcare. The employees are, we have designed certain activities where the employees need to come in and deliver some part of the program. So that keeps us connected and also invested in the program. Yeah, I think these are the challenges. Government is the biggest challenge sometimes, getting them permissions, etc. So fortunately, we have a reasonably good relationship with certain departments like education and healthcare. So we actually pitch in a lot of help when it comes to getting approvals for them. So that goes a long way. And a lot of government officials at the senior level welcome corporate donations as well. So they are quite helpful in that sense, but it initially took time, but now it's easy. So yeah, thank you.
Thank you. So Vijayanand sir, I mean, you talked about working both at the ministry level, at the Government of India level, and also at the state government level. And you also said, these days even district collectors are very, very active in sourcing money and building partnerships. So what do you think are the challenges from the NGO point of view in these collaborations?
Yeah, some big challenges, of course, the trust deficit, very palpable. Fund squeeze, it is very much there, not just the foreign funds, local funds also. Then something which the donor should be particularly mindful about, the compliance burden. We have gone into a very rigid project mode. Even an organization with fantastic capabilities like Pradan has to overwork to do the compliance burden. Just see the ordinary NGOs, the million or 3 million NGOs in India, or at least 1 million NGOs. So that we need to, what I call ease of doing good. That is not there. That is something, is a major challenge. Then, of course, FCRA restriction, everybody knows, not very reasonable, but then nothing can be done about it. And then there is no, my personal thing is that we do a lot of good work, the livelihoods, last mile connectivity and all that. But ultimately, the core objective of an NGO is to show the mirror to the government and say, this is wrong. Tell the truth. The satyagrahi, the public action, accessing rights, promoting values, the deep structure of programs. NREGA is not just work, there's a deep structure. So that advocacy part is a big no now. I don't think anybody can change it very quickly, but still there are spaces. So we should be very positive about. But something I find recently, the dialogue between the NGO and a policymaker, not the minister, at higher levels is reducing. Dialogue means you can go and talk to him. That's not the dialogue. As additional secretary in charge of NREGA, I've been beaten black and blue by activists. I had to answer them. I mean, all kinds of allegations which I never imagined, but having some truth. So I had to respond to them and probably make corrective things. That is missing. That's what they are, some of the challenges. But to get over the challenges, I have some bureaucratic answers. When you really study the policies and programs of government, you will know where they really require support. That's one thing. Then even very backward areas may not welcome you. But there are certain areas where government can't do. A typical area is a PVTG area. So there are a lot of spaces where professional support is lacking. And then since NGOs have a formal, informal network, we know where we are welcomed, which department welcomes you. And sometimes it's personality dependent. I know of this thing, a senior retired Government of India secretary is highly respectable, went to his own district and said with an NGO and said, I'll do this to the collector. Collector said, thank you very much, sir, but don't mention that you met me, you do whatever you want. So that culture also exists. Then, of course, we can mark out these geographies and create this. Then another thing is showcase successes. Recently, Pradan came out with a compendium on its livelihood successes. It's a textbook, not just a propaganda. It's a document. It's not a coffee table book. It's how exactly they managed and how they moved ahead. So progression in achievement is something which this thing, and high quality case studies where donors should do. I don't think an NGO can write a case study. It may not be credible. So you get some IRMA or some IIM to write case studies on NGO kind of things, because there's a lot of suspicion about NGOs. And if you look at their achievements, I've been studying their achievements, not as an NGO, as a development practitioner, right from the days of vaccination in the 60s, Green Revolution, huge successes. Sometimes innovation, sometimes performance, quality, deepening. So they have not been documented. If a document comes, I recently saw that million missions kind of thing, but that's very sketchy. You can get into some 100 case studies of what NGOs have done. India will take note. That's a big need of the time, which of course has been done by a lot of material and all that. So that will be very useful. Then one important advice to NGOs is to work with grassroots institutions, as I mentioned earlier. And then what are the do's and don'ts I've been asked to say? In 2 minutes, I will say. Do's will be, you have to be community-based and you socially accepted, at least by the persons you're working with. That's a surefire way of not being plucked out. The panchayat, the SHG wants you. Nobody wants to be unpopular by removing a development entity at the cutting edge level. Then transparency and accountability. There is no social audit of NGOs. So I've been trying to promote social audit of NGOs in a very non-adversarial form. So if NGOs say that this is my disclosures, huge acceptance will increase. Even government will increase. You don't need an IB fellow to come and check your accounts. This is it, nothing more. So that is very, very important. Then the language is very important. English is a beautiful language. Feedback for improvement. You can criticize in this thing, but beautiful English. So it's criticism, but it's a feedback for improvement. Then if you're of real value to officials, particularly cutting edge level officials, you're tolerated and accepted. That I found even in crisp work. We may be retired chief secretaries, but your Gram Sevak may not accept you. So that is very, very this thing. And then of course, sharing the learnings across. Then don'ts, no false claims, no creative accounting, no. Then something I find is NGOs compete with each other. We can't blame them when there is shortage of funds. This kind of brings down NGOs and reduces their effect. I don't know how you're all working with groups of NGOs. And then no poaching of HR, which is happening. I can give hundreds of examples where you poach good HR. And then at this point of time, as a human being, I don't like to give that advice. No open criticism. But I'll give you one example. There's no time, just half a minute. Mahatma Gandhi was asked during a speech, what is your topic for the day? When there was a censoring, the SP came and asked him. And he said, roll of goat's milk in one's diet, daily diet. The SP walked away. But Mahatma Gandhi, being what he called him, and said, I will use this opportunity to criticize His Majesty's government. So you can, on roll of goat's milk, you can bring a lot of criticism. But I'm saying you have to give this thing. But then one thing, which I had been advised as a civil servant by my director in the academy, choose your battles. You can't fight every little thing. Sometimes you have to choose your battles. And you may lose, but that compromise on values should not be there. Thank you.
Thank you, sir. Great thoughts. So, Archana, your foundation works across the world. So, what challenges you face in these collaborations?
So some of the challenges, the peril of going last is a lot has been said already, but I would just underscore from our perspectives. So some of the challenges that we tend to be a large scale foundation. So say, for example, in the state of Bihar, we work in all of the 38 districts. In UP, we are working in all of 75 districts, right? So definitely, small siloed approaches, duplicative approaches, approaches that are not necessarily that are largely anecdotal and not necessarily backed by data and evidence would be a challenge for us, right? So for an organization that is like ours, that's working with government to solve for large scale issues, tends to look for typically scale and data and evidence rather than we know that, not to say that either anecdotal evidence or small scale projects are not necessarily working well, but you do tend to look at data and evidence. even in pilots that can be replicable at scale, right? So a lot of rigor is what we tend to focus on. At the same time, I do understand that there are challenges in terms of capacities. There are challenges in terms of, how do you get smaller NGOs to be able to, how do they communicate with a large donor like us? That's also sometimes challenge. A lot of our, especially with the FCRA laws that went stringent, the bigger NGOs that actually work with smaller NGOs, they were kind of being the voice for the smaller NGOs. And now with the FCRA law, it becomes difficult. But a donor does, Vijayanand spoke about compliance. We do have our processes, and we do have our, donors do come with certain degree of compliance as well. So now these are things that we normally cannot move away from, but I do realize that these are challenges. But at the same time, from a donor perspective, with the change in FCRA laws, like at our end, paperwork has increased because we have to work with a lot more of organizations. So from our end, our focus is a lot more. Gates Foundation is focusing a lot more in terms of working with domestic institutions, domestic organizations. There's a lot move away from international organization because in the long run, we do realize that the capacities have to be institutionalized in the country that we work in. So, off late, we were being criticized saying, hey, you don't work in capacity building, but now Gates Foundation has corrected itself to work with capacity building. An organization like Pradan can really help because they work a lot with the other institutions and therefore, grassroots level experience. So, an organization like Pradan is helpful for us, but there can be other models where we can work with a large scale organization that understands at the grassroots level, but also realizing that capacities have to be built down below. So it is bringing us closer to reality. We are investing a lot more in terms of capacity building as well. But we totally understand the challenges that exist in the ecosystem today. I would say that while we look at the challenges, some examples of when it works really well, say, for example, I go back to the TB example, we're sitting with a highly motivated additional secretary who would bring in about 200 organizations virtually to actually speak about the tuberculosis program, because it has to be scaled, it has to be delivered across states, it has to be delivered across districts. And therefore, making sure that there is, it's a participative model, roles and responsibilities clarified, making sure that these meetings are happening at a certain cadence, maybe at a monthly level, taking stock. The responsibility was also from, of partners to collect data, which means that they were interacting with the NGO sector, making sure that the data was reaching the government in a transparent manner. And making sure that there was feedback loops, looking at progress, what's working, what's not working. So I think there are ways in which, collaborative models can help solve for some of the either information asymmetry, power asymmetry as well, being more participative and collaborative, getting feedbacks. It can work when it has to work. Thanks.
Thank you. At Dhwani, we work with a very large number of NGOs, and we have also started now working with the federations of NGOs. So our federations also want to collaborate with government, and what we call as making a policy work. So that is one of our agenda points, that how federations and their partner NGOs can work with the government to make a program successful, implement a program successful. So Archna, what is your advice for such institutions?
I thought you would ask Vijayanand first, but it's okay.
And we can change order. So.
Yeah, no. From my advice would be a little bit is looking at the ways the country is evolving. There's a lot of focus, and India is actually blessed in terms of access to digital. It has been a transformative journey in terms of how services, provision, programs that are being delivered with digital technology. So I would say that that's one of the areas that we think would be transformative for us, for Gates Foundation, in terms of how we engage with our partners, how we engage, how we capacitate partners as well, how we engage with governments and make sure that government programs are more inclusive of digital technology. So my advice would be embracing digital, because it brings in a certain degree of transparency, it brings in faster delivery, faster feedbacks. Even how we are collecting data now is a lot more digitally informed. So I think it's transforming the way how our programs are being looked at. The second advice I would say is, and therein, because of the language models, I think the inequities are also again being bridged to a certain degree. The second advice that I would have is again in terms of data and rigor, because I have to say that that's the DNA that Gates Foundation comes with. So and also insights, right? I mean, because the NGOs bring in insight that we don't have, and cultural context that we don't have. So it's more in the language of data and evidence that can be brought into the organization is highly valuable, highly valuable to the foundation. And the third I would just simply say is just being more understanding, like while we understand feedback loops, understanding of what are the models that need to be translated downstream for delivery, and learning from each other, so that the nuances of the program, or how you would have, say, especially, let me just elaborate this a little. If you've seen a pilot work in a certain manner, as it goes towards scale, there are certain nuances, and those need to be translated so that you get impact and outcomes faster. So I would say that as long as those can be preserved, it leads to impact and outcomes faster. Thanks.
Vijayanand sir, what is your advice to grassroots NGOs and federations for collaboration?
In fact, I think 4 or 5 years ago, I met a lot of grassroots NGOs in one big meeting in Madurai, in Dindigul, and I was really saddened. They have a sense of hopelessness, feeling that we are not wanted, and they are not there for money, most of them. Small NGOs, maybe working in half a village or something. So we need to look at them. The last man, the weakest, Gandhiji's principle of Antyodaya works in NGOs also. So that's a very, very important thing. And then how to motivate them. That's why I said that recording what NGOs did. That'll go, oh, this is the thing we have done. Not through big NGOs. Big NGOs didn't exist. The old Gandhian NGOs were very local. The old, what we call voluntary organizations. So that is very important. Then can anybody come out with a status report? Like ministry publishes state of panchayats once in 4 or 5 years. So once in 5 years, not by an NGO, some by a body which collects from different NGOs over a period of time. And we say, this is what is the thing. People can disclose, not disclose. Then of course, newsletters are there. But a very important point I wanted to say, you are all doing it. Pradan is also doing it. Systematic capacity building after a training needs assessment. Exactly what Varghese Kurian did. I've been taught by him as an IAS trainee in IRMA to build the capacity of cooperatives with zero capacity. And at that time, semi-literate. So the administrative part, it can be modular. The managing an NGO, administration, I mean, all the records and all that. Ethics and values of NGOs, developmental aspect, what you can do in livelihoods. People don't know. They have good heart. So if we can structure it, that will be the ultimate thing. And that can be structured only by a consortium of people interested in it, like a neutral body, almost like the chartered accountants. It's not government run. And if they can do it, nothing like that. Plus, as we have this citizen service centers. So can you have an NGO service center even online? You can ask us, we'll tell you, a help desk. We'll tell you everything, frankly, and we'll even maintain secrecy. Will be very good thing. And when I started my career, at that time, it has become a little old, 5-6 years old. There's a book called, many of you would have seen it, Old NGOs, where there is no doctor. Anybody who reads it will become at least a nurse kind of expert. So we need to prepare that kind of document for NGOs. Don't think they know everything. Even we struggle. You ask, we can go to a chartered accountant, we can go to a top lawyer. Pradan or Chris, we have a lot of persons, just ring and they will tell you. But a lot of others have this kind of thing. Then an impossible request. Can there be a donor consortium that we will fund health and then look at NGOs? We will fund smaller NGOs. We will build their capacity to work before we fund. There are a lot of models like that. Because why are NGOs there? Not to deliver development. There is something called social capital, something called altruism, which keeps society going. I'm sorry being a little emotional and philosophic. We need that part of the NGO. Not very professional, this kind of churning out reports and graphs, but that is missing. That is the old Gandhian thing. And I knew from a lot of people how it existed. Then, of course, RCRC was a fantastic coalition. And now it's transformed itself. That's a model where big, small, no difference. We work, we pool our resources. That seems to be the model. And of course, a code of conduct, which emerges from below and maybe a self-regulatory body. It will be very, very important. So these are some of my thoughts on what you could do. But I would say, at least for the donors, focus on the small NGO, the micro NGO, and not even the small, the micro NGO, the numerous. Thank you.
Thanks, sir. Actually, at Dhwani, we are doing a bit of what.
Yeah, I've read about it.
Right.
I've read about it.
So,
but it has to be organized,
yeah.
and I would say it has to be physical. We think online courses just don't work.
Yeah.
For example, in 21, Kila does the best training in India. It was a total failure because of COVID. So we need at the block level, or if it can't be done at the district level, people will come and they will pay for their meals. We don't have to be free, but high quality stuff has to be delivered. We have trainers, we have resource persons in every district, in the local language, and a manual. It will really help. And it will help donors ultimately, because their funds will be better spent.
So, Shaina, so what is your one message to our NGOs?
The NGOs should, like everything that Mr. Vijayanand just described, is the need of the hour. If NGOs need help, and if they work in certain sectors, I hope there is a way for them to reach out to large organizations like us and take some support. All of us are very keen to build their capacity, provide pro bono time and effort to build strategy, capability, even get them people. But I don't know. I don't know where these micro NGOs are, honestly. We work with a handful, and we're not as big as Gates Foundation. So how do we, somebody has to help us, reach that, cohort. So yeah, so thank you for setting up this platform so some of them can listen in and, find out and how can we help them, how can they help us, vice versa. But I think from my company's perspective, we are committed to, supporting the NGO to build their capacity, help them think through stuff, get them legal help, get them financial support, and showcase their work to a larger audience. We've been doing that consistently at all of our Embassy Engage series, where we bring in NGOs and help them, give them a showcase for their work. And hopefully in time, there will be more structure to this. It's currently not very structured, as Mr. Vijayanand pointed out. Even it's a huge effort to bring donors into a room to talk to each other, large foundations, large donors, government, yeah. Government also needs to know how to ask for help, who to ask for help, which geographies to do, focused on what. So I keep mentioning this a lot, saying that if there was a leadership, that is dedicated to this line of, these areas of work, we can probably have more direction. Currently, it's Schedule 7 and it's as vague as that. So it's not structured. the giving is not structured. So if there is a directive to, let's say, all the donors in Karnataka saying that, guys, these are our focus areas, these are the key NGOs, these are the areas. So try and focus on these areas of work. There may be some collective growth vis-a-vis companies trying to figure out, where do I find an NGO and what work do I do with the money I have to spend? So that's an area that's always been a gap. And unless there's leadership in that area, it's very hard for us as corporates to also know what to do.
So thank you all, and we'll take some questions now. If there are any. So Melinda, can you take over?
Yeah. So whole lot of questions are there. I don't think we have time to take all of them. Probably I can just pick a few. So we have one question from Mr. Harish Babu. He's talking about government schemes today involve large multi-sectorial funding, yet NGO engagement is mostly limited to contractual arrangements with little or no mutual dialogue. Many officials don't view NGOs as partners, but merely as contractors, especially small and medium NGOs. This undermines the spirit of service. How can NGOs build meaningful value-based collaborations with the government? It really comes up very frequently.
I must say, now I don't have to confess, it is an unfortunate truth.
Yeah.
The spirit of the times.
Yeah.
But how we can value that, I've seen some NGOs values. After some time, people realize that this is really good. So I have to go and see. I can talk to them. So it's a longish process. This is a way to attract, but I don't think by policy government will do it. But we all should hope for a rejuvenated Kapat kind of thing. It was set up with huge idealism in the 70s. It is called PAD India, People's Action for Development of India, and Technology, Advancement of Rural Technology. I've studied, because I was asked to restructure Kapat, I studied the history.
Okay.
Unbelievable kind of idealism those days, the Gandhian kind in 70s. So we need to revive that for this kind of work. But I don't expect it to be revived in the near future.
It's a long journey.
Yeah.
Yeah. So another question, what are the biggest bottlenecks in donor government NGO collaborations today? How can these be systematically addressed with agility? What are the biggest bottlenecks?
Shaina, you want to take that?
I
Shaina or Archana?
I think I said a lot. I let my other panelists speak.
We have covered that.
Yeah. And so one question specifically to Mr. Vijayanand. What are some realistic pathways for exit for both donors and NGOs so that the government is able to sustain and own the effort going forward?
Meaning sustainable for
What are some of the realistic pathways for an exit for both donors and NGOs so that the government is able to sustain and own the effort going forward?
No, that is when you reach a certain, like AIDS is a classic example. You withdrew when it was really, you withdrew very gradually.
Yeah.
And now most governments are doing it on their own with the state AIDS control societies with little kind of thing. That's a big, that's where case studies will help you. When to exit, when to move on. NGOs can't be there forever. Then moving on. But then NGOs also provide jobs. Not all of them are volunteers. So it's the human resource part of NGOs is not much understood. How many people are working, how much they are earning. That's also not much understood, except big NGOs.
Yeah. Okay. And so we have a question from another federation from Tamil Nadu. So she says we are running a federation called Women's Livelihood Federation. Many schemes available under MSME are not accessed by many rural women. Is it possible to bring MSME, CSR funds and like-minded NGOs together to ensure that these schemes are accessed by the rural and urban women? Shaina, you will be able to take this question? No.
No, it's very, very easy. All that is required for the state livelihood mission to they have done it.
Right.
When from Delhi, I saw Tamil Nadu doing it, calling the donors, calling the NGOs, and calling the government programs, sitting together and kind of linking. It's not very difficult, but somebody has to take the lead. Ideally, a committed government servant from the livelihood sector.
And there are other initiatives. Niti Aayog has a platform which is called Women's Entrepreneur Platform. They're trying to bring in entrepreneurs, women entrepreneurs forward. And now, not just working. So one is that, actually with the MSME ministry, but also with Women and Child Development Ministry, a collaborative they formed centrally, but now they're moving from state to state as well, trying to bring together, state missions as well onto this platform. So there are efforts that are happening nationally.
Okay.
If somebody wants to know, the platform is live. It's called Web 3.0. Can look up that website as well, because there is onboarding that's happening, and then it can help access, because Niti's created a public-private collaboration at the central level as well, which means that there is already some donors who are participating, UN agencies that are participating, private sectors participating. So they might be able to get some further, boost to what the effort they'd like to do in the state.
Okay. And what advice would you give NGOs that rely solely on individual donors when navigating cross-sector dialogues, often dominated by institutional funders and state actors? Difficult question.
Vijayanand ji, I'm going to point.
This is an area where I know a lot of people who get this individual donations and do real good work, but it's uncertain. Individuals will not keep on donating. So that uncertainty is too high, and we have no easy solution, because we don't have that kind of network of high net worth individuals or regular donors. And of course, there are regular donors to help age, and that's a different thing. But for common NGO, there's nothing. So probably there could be somebody doing a crowdfunding from such people, so that they can track their money. This money is for this, and you connectors, like the aggregators of these days. It's such some people that probably Dhwani can think of that.
Okay. Good. Thank you. So any one line final takeaway from the three panelists for the attendees? Just closing remark.
I have for the bigger donors and others, that capacity building, planned capacity building, modular, physical, decentralized, based on a curriculum arrived at after a training needs assessment. That's my only request. And the results can be huge, as we saw in the cooperatives.
Okay. Archana, your one line.
I think I'm taking away a few learnings for us as well. One, that we are committed ourselves to work with domestic organizations, domestic institutions a lot more. Even innovations come in domestically from India, because frugal innovations, domestic, huge capacity in India, and not just solving for India, but also for the world. But at the same time, we're also committed to being more equitable. Vijayanand ji mentioned RCRC. We supported that network as well, working with grassroots level organization. But at the same time, I do acknowledge that there can be a bias of, bigger organization versus smaller organization. That tends to be a bit of a difficulty of being a large donor, but we try and be equitable. But I'm taking away learnings in terms of, can we document? That's something that we do pretty well. I think we have the capacity to document work being done by other organizations, by NGOs as well, especially in the areas that we work in, right? So I take that on board, that perhaps we could do that, and we can do that much better. We've been doing it, but we can do that much better. The second thing is that if there are collaboratives that can be formed, which will allow us to work across, not default to the NGOs that we know, but also work with NGOs who we don't know, right? And who may have the technical expertise, who may have the expertise that we are looking for. But if such collaboratives do exist, and for us to also spread the word, look beyond what's obvious. So those are learnings that I'm taking for ourselves, that we can further strengthen our work, because after all, we are striving for more impact. So if there are solutions that can be alternative to what we are doing already, I open my mind as well as heart and welcome that opportunity. Thanks.
That's good. Yeah. Thank you, Archana. Shaina, any one line takeaway or two lines for the CSR community?
I think for all the donors who are listening in, and those of us NGOs who have donors, I would say that, think about, instead of waiting for someone to become a leader, to lead us in this direction. Some of us take leadership and align each other's visions and look at a very collaborative model to give back. Create a robust system for trust, transparency, and accountability. And this is the foundation for longevity when it comes to collaborative models. Be a little flexible when you design the program. Allow room for improvement. Allow room for the NGO partners to, give them a breather to take the time. And as Mr. Vijayanand pointed out, invest in building their capacity. And don't expect, outcomes to be confused with completion of a project time on a timely manner. When you look at outcomes, be a little more inclusive and nurturing of the NGO, because I think at the end of the day, all of us need to remember that this is a government mandate that we are trying to fix, and at some point align with government so that we are not working in silos and trying to create small areas of excellence instead of creating a larger narrative and building the nation. Thank you.
Thank you, Shaina. So we are coming to the end of the webinar. A very, very big thank you to all our
But
three
first of all, let
panelists.
me congratulate you for a wonderful thing. I never expected such participation and the questions in the chat box. I mean,
There
people are
more
listening
questions,
and
yes.
yeah, not questions, comments also.
Yeah.
I think it's a testimony to the quality of the whole thing. So
Yeah.
we also benefited.
Great conversation, and a big thank you to all the three of you, Mr. Vijayanand, Archna, Shaina, for your time and for sharing such valuable insights today. Very engaging conversation. Thank you all. And a big thank you to all the people who are attending today in very, very large numbers from all over India. Thank you. Truly appreciate your time and participation. So see you all at our next Grants Plus webinar. Have a good day. Thank you.
Thank you.
Bye.
Sir, thank you all.
And thank you.
Vijay and Lalita, thank you.
Thank you.